this is Smita Kumar, and you're watching Medicircle. Today, on our healthcare startup series, we have Venkatramani Suresh with us. Suresh holds immense experience as Chief Business Officer in the internet industry. He was previously the Chief Sales Officer of Naukri.com and later the Chief Business Officer of Matrimony.com. He has completed a management development program with the Wharton School, and he's currently the co-founder of Karkinos Healthcare. So welcome to Medicircle, Venkatramani Suresh.
Thank you. Thank you so much, Smita, for this wonderful opportunity and look forward to interacting with you.
Same here. The pleasure is all ours. And as there are so many innovations going on in the healthcare startup domain in India, let's find it out how Karkinos is solving a lot of problems. So, Suresh, as the IBEF estimates the Indian healthcare industry to be worth $372 billion by 2022, and healthcare is possibly the most varied sector. There are so many startups all across different fields like telemedicine, online pharmacy, personal health management, home health care, medical devices, and some very exclusive ones like biotech, biopharma, and genomics. So, in your view, how are the Indian startups contributing to the economic and the social growth of India?
Yeah, well, I think I need to look at it from two or three different perspectives. As to what the current Indian startups and specifically the healthcare startups, how are they impacting on the economic, social, and the financial impact for India at large. Before I actually get in there, let's also look at what has happened to the consumer behavior, what has happened to technology adoption and digital adoption in the last 24 months. A blessing in disguise is what I would say, thanks to the pandemic in some sense. All of us have witnessed a huge paradigm shift in the way the consumers have adapted to internet and the consumers have adapted to technology. And if you were to look at today, someone who is sitting at home and accessing an Arogya Setu app and booking for an RT-PCR test, has become the norm. This is obviously being a behavioral shift which has been forced on to the consumers because of the pandemic. And some of these behavioral shifts in the consumer behavior actually has kind of been a force multiplier for the startup ecosystem in India and specifically to the healthcare ecosystem. Because I'm sure you would agree that the healthcare has taken a paramount importance post-pandemic in the minds of consumers. So when I look at from the employment perspective, the startups not only help patients gain access to quality healthcare, but also create job opportunities. The sector, as per an Invest India report, by 2020 will create over 40 million jobs. And we have seen over the last 12 to 18 months, the amount of interests foreign institutional investors have had in the healthcare ecosystem of India. So with a conducive environment which is available for startups in India, in my view, they are going to continue to generate more employment opportunities and solve existing challenges which are facing the healthcare ecosystem through technology. Not just about creating employment, but from an R&D perspective, India has got a phenomenal competitive advantage, which lies in the fact that, we have seen in the past few years, the abbreviated new drug application or the ANDA approvals, which have gone through the roof in India. And India also offers vast opportunities for R&D as well as medical tourism. So to sum up, I would say there are vast opportunities for investment in healthcare infrastructure in both urban and rural India. And when I look at the social sector, technology actually has been benefiting patients in remote areas. I mean, if you look at the healthcare startups which have come up in the last probably 24 months, most of them are using personalization to their advantage and upgrade preventive models and treatment to satisfy patients' needs. Artificial intelligence, augmented reality, virtual reality, robotics, and 3D printing are some of the key technologies that we have seen where the healthcare innovations have happened. And Indian startups today are leveraging these technologies to create locally relevant and novel digital solutions that would address the health challenges. As a result, these startups actually have become an integral part of the healthcare ecosystem. The way health tech companies are now looking at telehealth is actually more serious than ever before. And in fact, even consumers have started adopting telehealth to a larger extent. So this is actually benefiting the isolated patients with a cloud-based technologies to patients with chronic diseases who actually fear visiting hospitals in the current context of COVID. Uh, in my view, solutions such as artificial intelligence, chatbots, voice interfaces are actually going to be the norm of the day going forward, whereby healthcare and the healthcare experience will be customized and be provided close to a patient's home, and just not private. In fact, I would also look at the Indian government, which is playing a very significant role in improving the healthcare access through Pradhan Mantri Arogya Yojana scheme. And digital healthcare is a significant part of the central's plans to digitize India. Even the Ministry of Health and Family Welfare, as we speak, has launched several initiatives for delivering affordable, quality, and better care, and also to lower the burden of costing. So these are some of my thoughts, when it comes to how startups are impacting the economic as well as the social impact.
So especially we have seen a rise of these healthcare startups post COVID and even during COVID because the problems were real and these healthcare startups were
True,
trying to resolve these kind of problems. So what is
true.
about, tell us something more about your product and service and how is it helpful in shaping the Indian healthcare ecosystems?
When it comes to Karkinos, the some of the problems that we are trying to solve are one, as per a WHO report, 1 in 10 Indians are likely to have some sign or symptom of cancer over the next 5 or 10 years. And when we speak about this, we are today with a population of 440 crore people. We are talking about 14 crore people who are likely to have some sign or symptom of cancer. And this is a time bomb waiting to explode. And Karkinos is on a journey to provide cancer care closer to home and we want to ensure that quality cancer care is available at an affordable rate for anyone and everyone who needs quality cancer care. And India is one of the very few developing countries that has formulated a national cancer control program. The National Control Program looks at control of tobacco-related cancers, early diagnosis and treatment of cervical cancer, and distribution of therapy services, pain relief, and palliative care through augmentation of health infrastructure. And that's exactly what Karkinos is trying to get at by improving accessibility, availability, and affordability of cancer care. Another huge problem that we face today in India is 75% of the cancer cases are detected at stage 3 or stage 4. And this is primarily because of lack of awareness, lack of education, and there is a tremendous taboo about cancer. We want to kind of say, let's talk about cancer, and that's the primary objective that we are working on, focusing on the early detection of cancer. And if you look at what we intend to do is with a vision of a hub and spoke and further spoke model, which enables connectivity amongst all centers, seamless access to data, diagnostics, and patient consulting, which includes a combination of central knowledge repository, diagnostic capabilities, and a common HR training pool. This actually leads to decentralization of expert care. The technology platform that Karkinos is building consists of a distributed architecture with development of tools and applications that will integrate seamlessly and securely to our Karkinos backbone in drug discovery, diagnostics, and treatment strategies. We also aim to contribute towards Atmanirbhar Bharat through drug discovery research and treatment innovation, large-scale screening, and longitudinal data to build robust AI and ML analytics, predictive models, and clinical decision support systems for real-world evidence. And at Karkinos, we are today creating a complex creating a platform for referral of complex cases, surgery, and radiotherapy for supported by a network of smaller centers for catering to diagnosis and ongoing treatment so that the treatment can be decentralized, thereby reducing the load on apex centers for non-complex treatment while increasing accessibility and cutting down on loss of productive days for the family. So this is what we intend to do, and hopefully we will be able to address the cancer burden of the Indian subcontinent.
Sure, Suresh, but as the distribution of these healthcare startups, whosoever is trying to solve a problem, sometimes you feel that there is a disparity. Like most of these complex and expensive solutions are there only in the metro cities or tier one cities. So, how do you think like you would be able to achieve some equity in healthcare, like we are there in the remote population of India serving, because there are so many patients there in the remote areas. At least 68.82% Indians are still there in they are the remote population, and rural population doesn't have these access, first of all, to better healthcare services, and the literacy level, the healthcare literacy level is also very very poor. So as a healthcare startup, how do you, serve, try to serve these kind of people who are very, very far from these continuum of care circles?
I think it's a very, very pertinent question, Smita. The very purpose of Karkinos today is to work on a hub and spoke model. And as we speak, we are working on forging partnerships with, a tired hierarchy of hospitals, clinics, and doctors across Tier 1, Tier 2, Tier 3, and Tier 4 cities, whereby our intent is to ensure that, irrespective of whether the patient or the citizen is in a Tier 1 city or a Tier 2, 3, or Tier 3 city, using the network of hospitals and our digital platform, we would like to provide quality cancer care through a distributed cancer care model. And just to give you some examples of what we have done so far. For example, in Kerala, in the Idukki districts, we have been able to build partnerships with multiple hospitals, and we've been able to screen over 20,000 people in the last 4 to 5 months. And we are very happy to say that we have been able to provide the facilities for people who come under the have-nots. And as you rightly said, whether you like it or not, there is a huge gap between the haves and have-nots, and those with the greatest need for healthcare have actually the greatest difficulty in accessing health services. And this is something, if this has to be addressed, and if you have to achieve equity in access to healthcare, this can be done by a combination of focus on service delivery and equity in health financing and financial risk protection. So if you have to look at how we can probably look at achieving equity in service delivery, is we need to work on efficient resource allocation among different levels of care between urban and rural parts of the country. In fact, our early journey has been the focus on the rural parts of India. That's where we went into Kerala, and we've kind of been able to achieve significant progress. Having said that, India still faces the challenge of sustaining adequate level skill mix,
Yes.
quality, and distribution of health professionals. Uh, and this issue is something that we need to address, because when I look at oncology today, there is a huge gap between the need of the hour, whether it is oncologists or whether it is nurses or medical professionals. So you just can't achieve equity by by focusing on delivery, but you also need to look at how can we reduce the burden of financial constraints. For example, low levels of public financing, lack of a comprehensive risk pooling mechanism, and high out-of-pocket expenditures, especially when it comes to a protocol like cancer. In the context of rising healthcare costs, are the key factors which are impacting equity in health financing and financial protection. So if you look at, only around 10% of the Indian population are covered by any form of social or voluntary health insurance, which means, today, if you look at a community-based health insurance schemes and schemes for the informal sector, which encourage risk pooling cover, which is only less than 1% of the population, right? So for a country which is as big as India and as complex as India, we need multiple interventions, knowledge, education, information, um, and with multiple people coming together. For example, government, NGOs, private sector, and the existing infrastructure. All of them need to kind of come together and break all the myths about not just about cancer, but about overall affordability and availability of quality care.
Definitely.
So in my view, this is kind of, it's not a difficult task, but it needs a dedicated focus, and applying an equity focused approach to the collection, use, and application of data on health outcomes, and processing this would probably be also able to solve the problem. So in my view, the focus on artificial intelligence, focus on database decision making, all of this will probably be able to kind of help us address this huge problem.
Definitely. And as you rightly mentioned, that affordability is one of the major problems which the rural population is actually facing. Because on an average, a rural patient spends approximately 65% out of pocket expenses on his or her healthcare demands. So definitely it has to be taken care of. And I think it's a mix of government, private, and NGO bodies would be coming forward and supporting, along with the support of uh, startups like Karkinos, where they are building a platform so that we can have affordable and, most importantly, quality cancer care. So thank you so much, Suresh, for joining us today at Medicircle and sharing your insights about how your startup, Karkinos Healthcare, is giving good patient experiences and also trying to solve some very big problems in India. Because as the WHO said, and as you mentioned in your interview also, that there are around 1 in 10 Indians who may develop cancer during their lifetime. But here I would like to add one more fact that and in one of these 15 will die of the disease. Now that's very, very worrisome. And every year, 2.25 million cases of cancer they get diagnosed. So that the number of cases is doubling every year. Many of the cases
Right.
get diagnosed late, which is a very important reason for more and more patients dying of this disease. And that's putting more pressure on correcting the late stage cancers with treatments. So it was really good talking to you on Medicircle, and through Medicircle, we'll try to have more and more healthcare startups who are trying to solve a problem, especially for the rural population in India, and trying to build a solution and innovation which is going to make the healthcare experience more affordable, accessible, and most important, available. Thank you once again, Suresh, for joining.
Thank you, Smita, for this wonderful opportunity. Thank you.